So with no further ado, I'd like to hand the mic over to Nettie Rose Cooley, who is the CEO of the Block Island Health Center, and she will take over in terms of our introductions. Nettie Rose.
Thank you, Joe. Good evening, everyone, and welcome. As Joe said, I'm Nettie Rose Cooley, CEO of Block Island Health Center, and I'm pleased to be co-moderating tonight's discussion with Joe Lawyer, as he said, President of Block Island Resident Association. On behalf of Block Island Health Center and Block Island Residents Association, thank you for joining us for Ticks on Block Island, a public health crisis. Our goal this evening is to provide information, share different perspectives, and discuss how we can better understand and address the growing impact of tick-borne disease on Block Island. We are fortunate to have an outstanding panel with us tonight, bringing perspective from science, medicine, local government, and state government. Dr. Sam Telford is a professor of infectious disease and global health at Tufts University and a nationally recognized expert on tick-borne disease. His research has helped advance our understanding of Lyme disease, alpha-gal syndrome, and the environmental factors that influence tick populations. Dr. Liz Moran recently joined the Block Island Health Center as our Chief Medical Officer. She is returning to Block Island Health Center, where she previously trained as a Brown University medical student and later as a resident physician from Arizona, bringing extensive experience in family, urgent, and emergency care. Keith Stover serves as our first warden for the town of New Shoreham and has been deeply involved in the town's efforts to address the public health challenges associated with tick-borne disease and deer management. Senator Alana DiMario represents District 36 in the Rhode Island Senate and has taken a leadership role in advancing state-level discussions and legislative actions related to Block Island's public health concerns. We're grateful to each of our panelists for joining this evening and for sharing their expertise and perspectives on the important issue. At this time, I'm going to turn it over to Joe Lawyer one more time.
Just a reminder, it's a Q&A at the bottom of your screens, and we would encourage you to again, submit questions throughout. We will be addressing questions. We'll be asking each of the panelists to respond after all four panelists speak. So, but by all means, submit them throughout, and then when we get to the Q&A session a little bit later, we will be posing the questions, and hopefully we'll get some excellent answers from all four of our panelists. So I think at this point, I'm going to hand it over to you, Sam, and I'm going to just kind of share your slides to start, and we will let you start.
Right. So I came out there last September at the invitation of BIRA after not having been on Block Island for maybe 30 years. I worked out there on Lyme disease and babesiosis ecology and epidemiology in the early 90s through the mid 90s. And then my colleagues at Yale took over the study site, and I worked a lot on Martha's Vineyard and Nantucket. And was very pleased to be contacted by Joe to weigh in on what seems to be an emerging public health issue on Block Island. Next slide. Well, that's not my slide, but
there you go.
There we go. So at the time, I came out and the first thing I want to do is see what you have out there, whether things have changed since the mid 90s. And did some tick collecting, and was surprised to not find any Lone Star ticks. We did get deer ticks and Asian longhorn ticks, but no Lone Star ticks, despite the fact that people on Block Island were reporting Lone Star ticks, and there were cases of alpha-gal being diagnosed locally. Oops. Oh. So I was out there 2 weeks ago. At the time in September, because I could only be there for a day, less than a day, looking around, I asked the people attending the talk that night to save ticks for me that they found on their person and record where they found them and the date. And people were very, very good at this. And I also visited 2 weeks ago to do some tick collecting, again, a day trip. And we did find at least one Lone Star tick at each site. We did 4 or 5 different sites, the historic ones that we used to work in, Turnip Farm and Rodman's Hollow. And consistent with what I've been finding across Rhode Island and Massachusetts, there were very few deer tick nymphs. So we got fewer than 100 for a whole day. But what you see there on the left is oh no, that's
Sorry.
yeah, there we go. Is the collection that we made. My wife and I, my wife's a tick biologist as well, did a bunch of collections all day. And most of the ticks that you see there are actually Asian longhorn ticks, which is an invasive tick that arrived in the US sometime in the early 2010s. And have spread rapidly because they do not require a male to reproduce. And there were deer ticks, there were Lone Star ticks, and we found nothing unusual in terms of the numbers. I would have to say that like deer ticks, we probably got fewer than 100 Lone Star ticks. However, with the tick samples saved by residents out there, we got a total of 74. And most of the samples were a single tick, and there were 40 Lone Star tick adults, 19 Lone Star tick nymphs, 6 Asian longhorn tick nymphs, 3 deer tick adults, and 3 deer tick nymphs, and even 2 dog ticks, which I find unusual because you do not have the hosts that are required in order for that tick to reproduce out there, which are mainly raccoons and skunks. The odd dog, the name dog tick, of course, comes from the old biology of the dog tick, which did indeed subsist on dogs, but no longer because many dogs are on medication. Interestingly, one site, Lewis Farm, appears to be plagued by Lone Star ticks. There are many, many samples of Lone Star ticks there, but there were ticks submitted from all across Block Island, and the list of sites is there. And so it's clear that they are there. They are attacking people, and so the question now is, on top of the clear and present danger that we have in deer ticks, which transmit Lyme disease, babesiosis, human anaplasmosis, and Burley Miyamoto disease out there, we now have the specter of what Lone Star ticks may be transmitting, including its association with the causality of alpha-gal disease. Next slide, please. So I was asked to address the ecological factors that drive tick-borne disease risk. And these slides are for deer tick, the Lyme disease epidemic, but they do apply to Lone Star ticks as well. The main drivers for why we have a problem with Lyme disease, and it happened over 100 years, it didn't appear overnight, are that we cut down the forests in New England and we allowed them to reforest the land to reforest as pastures were abandoned. And we had what we called successional habitat form during the evolution of pasture back to forest. Now, of course, forest on the islands is very different than forest here in central Massachusetts. But you see here on the right, Pouts Pond in 1905 on Nantucket, and the same site 80 years later, and the vegetation is impenetrable, as you have on Block Island. And my guess is that I certainly know that the landscape on Block Island in the early 1900s was very much like Nantucket, and the landscape now on Block Island is very much like Nantucket, if not worse, in terms of being able to walk through the brush. There is increased development and recreational use in these reforested sites, and that's in a generality across southern New England. I was very pleased to see, though, after being away from Block Island for 30 years, that there has been relatively little, almost no development on Block Island compared to places like Nantucket, where one can't even get over to the island anymore because of all the contractors coming over every day. And then finally, the what I believe is the main factor, and that's the deer. There are more and more deer around right now, and the important point is that they're in between people's homes and within people's yards. And the deer came along as a result of game management laws, as well as the restoration of habitat. The picture from 1905 on Nantucket would not have supported a lot of deer, and indeed there weren't any up until 1928 when deer were introduced there. Very similar to Block Island when deer were introduced in the late 1960s, or reintroduced, I should say, because the Native Americans certainly had venison on their menu. Next slide, please. So it's important to understand that deer ticks and their various stages, they have four life stages: eggs, larvae, which emerge from the eggs, or so-called baby ticks. The larvae grow into nymphs, and the nymphs grow into adults, and then the adult female lays eggs, and you have the cycle start again. And these stages all have typical seasons of activity. Right now, we're at the tail end of the nymphal deer tick season. These nymphs originated from the baby ticks or larvae that fed last September. And those fed larvae overwintered and molted into or grew into nymphs in March or April. We're around from April through now, and are disappearing. And if they fed successfully, those nymphs fed successfully, they will turn into adult ticks, which will be around starting in mid-September, late September, and reaching a peak in October, November. They'll be out through the winter, and into May, and then they disappear. Although we did get a few ourselves a couple of weeks ago on Block Island, they in biology it's never all or none. It's probabilities, and the probability of seeing lots of adult deer ticks is almost none in July. So those adult deer ticks are around in the fall, through the winter, and into the spring, looking for large animals, things larger than a cat. And the only thing that is out there on Block Island is deer. And if they feed successfully on deer, the female tick will lay 2,000 eggs when it warms up in the spring, if they fed during the fall. And then certainly as they're feeding in the spring, it takes 3 or 4 weeks for them to digest the blood meal and lay eggs. Those eggs all hatch in mid-July. And you have all of these little baby ticks, the larvae around, trying to feed on small animals such as mice. And they're around July to September. They overwinter. So it's really the nymphal stage of the deer tick that is doing all of the Lyme disease transmission. The larvae are born uninfected, and typically you see very few cases of Lyme disease when adult ticks are around, even though twice the number of adult ticks are infected with Lyme disease bacteria. The size of the nymph, and that's one there next to the penny, about the size of a poppy seed, are such that you never see a nymph on you, and you're dressed differently during the summer than you are in the winter. That's why 85% of all cases of Lyme disease come from the months of June and July. Next slide, please.
Dr. Telford, 5-minute reminder.
Okay. So we need to think about two different things: reproduction of the tick and infection of the tick. And I argue that the place to attack them is the reproduction, because if you kill 1,000 baby ticks or nymphal ticks, it's compensated for by the single feeding of a single adult deer tick. Next slide, please. So I'm the nation's biggest advocate for removing deer to intervene against Lyme disease because of an experiment I did as a graduate student in the late 80s and early 90s, where we removed 80% of the deer on a peninsula on Cape Cod and watched the tick numbers decline over a period of 10 years. And those numbers remain stable to this day, because once the deer numbers were down, the caretaker was able to use normal hunting permits and keep the population to below 10 per square mile. Next slide, please. Now we have Lone Star ticks, and this gives me pause because Great Island does already, this place where we remove the deer has low numbers of deer, but the Lone Star tick has invaded. So we need to do something more than just 10 per square mile. It has to probably be half of that. The Lone Star ticks, all three stages aggressively bite humans. They have the same kinds of seasonality, although the adults are in the spring. The nymphs are about the same time as the deer tick nymphs, and the larvae are emerging now. And what you see here is a tick bomb up in the upper right, and on my pants on the bottom. On my pants on the bottom is about 30,000 larvae from a single 20-meter walk. And the foot on the left is a foot with no permethrin, and the foot on the right is covered with a permethrin sock. And that shows the power of the use of permethrin treated socks. Next slide, please. So what can Block Island do? And you know, I had been asked to talk about ecology, and these slides really should come at the end of all of our presentations when we consider what Block Island can do. But there are things that people should be doing. Personal protection using permethrin treated socks, trying to find better ways of managing deer, using insecticides. You do need to consider spraying or actually broadcast application of granular pyrethroid pesticides. Next slide, please. And I think we will need to consider medicating the deer as well as killing them, because you can't kill all of them. It's logistically, politically, and socially very difficult to eradicate deer from a site. But if you remove enough of them so that they're fewer, you can target them using bait stations. And I think that's the wave of the future with these places that are plagued by Lone Star ticks. And I think we do need to have a discussion about making deer hunting easier for those who do it. It's a lot of work to hunt deer. I hunt myself, not very successfully, because it is a lot of work to do it right. So with that, I will conclude this part, and will be, of course, commenting as we go along later in the evening.
Thank you, Dr. Telford. Up next, we have Dr. Elizabeth Moran.
Waiting for the slides. Oh, there we go. So I'm Liz Moran. I'm new on Block Island. I've been here about 2 months. I usually start every presentation by saying I'm a family medicine physician, which kind of by definition means I'm not a subject matter expertise in anything other than being a family medicine physician. So I'm just going to go through some basic tick-borne illnesses that we see at the health center here. And I think this probably will be review for a lot of people. But review is always good just to make sure we're all on the same page and we're all talking about the same things. So this is a slide that I lifted from the Rhode Island Department of Health about tick-borne illnesses that are seen in Rhode Island. And this kind of reflects what we see at the health center here as well. Along the bottom, you can see in small letters, the first one is anaplasmosis. The second grouping there, these are arranged by years, is babesiosis, then ehrlichiosis, and then the far to the right is Lyme disease. And those are really the blue, like the light blue, is total cases that are seen on a year per year basis, with Lyme disease kind of in the 2,500 approaching 3,000 cases per year, and followed probably by babesiosis, which is maybe 150, 160 cases per year. These are all reportable diseases, so reportable to the state health department by labs or physicians who diagnose these cases. So we feel like we have pretty good numbers on these. If something gets sent off to the lab, it's going to wind up in the health department's data bank, so we can keep track of them. Most cases in Rhode Island are in Washington County, and so we don't have specific case numbers for Block Island here, but it's a very similar trend to what we see, where we see mainly Lyme disease, some cases of babesiosis, and then much less common anaplasmosis or ehrlichiosis, but not never. Alpha-gal is on the list of tick-borne illnesses, but it is not currently a mandated reportable condition. The State Department of Health has asked labs and providers, it's like a requested reporting condition. So they take reports, but it's not a mandated reportable condition at this point. The other thing with alpha-gal that is important to know is just because, and this may be part of it, is just because someone tests positive for antibodies doesn't mean that they have alpha-gal syndrome. It's just an antibody test. So my understanding is that if a lab that does report to the state that they had somebody test positive for alpha-gal antibodies, that they follow up and do an interview based on CDC diagnostic criteria to find out if that person meets for this syndrome. So the lab that we use at the health center does report to the state health department if they have a positive antibody test, and they would follow up with that patient. The numbers for alpha-gal in the state of Rhode Island are in the less than 100 range. So that would be much lower, kind of in between probably the anaplasmosis and the ehrlichiosis, just for kind of perspective. It's pretty well agreed upon that that is an underrepresentation of the numbers because it's not a mandated reportable condition, and because of the having to meet diagnostic criteria, and that involves follow-up with patients, interviews, et cetera. So, but just kind of as a perspective of the tick-borne illnesses that we're talking about. Next slide. So Dr. Telford went over this a little bit. The deer tick and Lone Star ticks are the main ticks we're talking about. He also mentioned the Asian longhorned ticks, but really when we're thinking about Lyme disease, we're thinking about deer ticks and really those nymph stages. So again, as Dr. Telford pointed out, even though the nymphs, not every deer tick nymph, or even every adult deer tick can transmit Lyme disease, the nymphs are so tiny that they tend to be the sneakiest, and people are least likely to realize that they even had a bite from a nymph tick. Deer ticks can also transmit babesiosis, anaplasmosis, and less common ehrlichiosis. Lone Star ticks do not transmit Lyme disease. So really we're thinking about Ehrlichia and alpha-gal are kind of the two more common ones that we would be worried about with the Lone Star ticks. I can't remember if Dr. Telford pointed this out, but the Lone Star ticks, the males don't have that dot, so it can be trickier to figure out, if it was actually a Lone Star tick, if it was a deer tick. So there are ways to kind of get your tick identified if you're worried about that. Next slide. I'm going to talk about that in the next slide. So if you find a tick on you at home, again, I know this is review for a lot of people, but try to remove it with fine tip tweezers. It's funny to say it's review because sometimes we get calls like, what should I do? You should try to take the tick off if you're able to. Grasp it as close to your skin as you can. Try not to crush the tick's body. If you're going to, people that are trying to crush the tick, that can release all of the infectious agents. So you want to try and take the tick off by grasping it as close to your skin as you can and just pulling it directly out. Once you get the tick out, if you're not sure what it is, you can submit a photo of it to the Tick Spotters program, the URI Tick Spotters program. That's a great resource. It's pretty easy just to upload a picture of the tick from your phone to the website. And within 24 hours, you'll get a message back from them about what kind of tick it was and what stage of the tick it was. It was a male nymph deer tick, or it was a male Lone Star tick. So that can be really helpful in terms of, do you need to worry about Lyme? Do you need to worry about other things? Do you not need to worry about things? If you think the tick has been attached for more than 24 to 36 hours, you should call and make an appointment at the health center to get a one-time dose of doxycycline prophylaxis. Again, I know a lot of people know this, but we get calls all the time. If it's Sunday night, you don't need to come in on Sunday night. You can wait and call on Monday morning, get an appointment and come in. We'll give you a one-time dose of doxycycline prophylaxis. That does need to be administered within 72 hours of tick removal. If you found a tick on you like 3 weeks ago, then we're kind of talking about, do you have symptoms? Is there any particular condition that we're worried about? But if it was on for more than 24 to 36 hours, you can come and get a dose of prophylaxis. If it was on for 6 hours, you don't need to get doxycycline prophylaxis. So that's one of the reasons it's really important to do those daily tick checks. And if you have kids, you're around kids, really checking kids really well, because they, that could be another place where ticks would like to attach themselves. Next slide. So at the health center, there's a box for tick collection at the front desk. Dr. Telford came to pick those up a couple weeks ago, and that's some of the data that he referenced in there. So if you just happen to find one on you and it wasn't even attached for very long, but you want to send it in for data collection purposes, just kind of stick it on a piece of cardboard or an index card with some Scotch tape and drop it off. If you pull it off of you and you would like to send it in for data collection purposes, you can do that as well. Doxycycline, a one-time dose, decreases the risk of Lyme disease by up to 87%. So it is definitely worth it to come in and get that if you are concerned about Lyme disease. It's also important to know that that is safe to use in children. I think in older, certainly when I was first going through medical school, there was some concern about using some of the tetracycline, doxycycline in children. The one-time dose and even some longer courses is totally safe in children at this point. So definitely if you find it on a kid and you were worried that it was on for an extended period of time, maybe it's engorged. Wow, it is raining really hard. I'm sorry for anyone who's here right now. If it was engorged or you weren't sure, then definitely come in and we can do the prophylaxis dose. Again, it's really helpful to check your kids in the morning and then check them again before they go to bed. And hopefully you'll find any of those ticks that are on them for less than 24 hours. And then you don't need to worry about the risk that they have transmitted Lyme disease or some of the other illnesses. We don't routinely test asymptomatic patients for any tick-borne illnesses, including alpha-gal. Sometimes we've had patients who come in and they said, I just got bit yesterday and I think I need to be tested. There's not an indication to do that. And it's probably too early to test. In fact, if the tick bite was just 24 hours before. Symptomatic patients can be tested. So most people know symptomatic for Lyme, headache, fever, flu-like symptoms, same thing with all of the tick-borne illnesses, really. Somebody is feeling unwell, having malaise, fevers, come in and we'll do the blood testing. It typically takes about 2 weeks after exposure for a blood test to turn positive. So if you are having symptoms, you should still come in because we can do other tests like a rapid flu test or a COVID test that have similar presentations, headache, fever, arthralgias. So it's worth coming in and just talking to one of the providers here in the health center and figuring out, should you be tested now? Should you start an empiric treatment? The erythema migrans rash, which is up in the corner, that definitely warrants treatment. And we start people on doxycycline that same day, usually for that. So definitely come in and talk to us if you have any questions about what's going on. But again, if the tick was attached for less than 24 hours, you don't need prophylaxis. So next slide. And then Dr. Telford, Dr. Telford stressed this. Stress this as well, that prevention really is best. So when people come in to talk to us about tick-borne illnesses, we always go over, what to do next is to get the permethrin-treated socks, to get the sprays for your clothing and your shoes, doing the tick checks on a daily basis, making sure your pets are medicated if you're able to, tucking your pants into socks, wearing long sleeves, light colored clothing makes ticks more visible, staying on the middle of the path or avoiding lots of brush or doing tick checks after that. So we really want to emphasize that prevention is best. We all, I think I speak for myself. I love being on Block Island to be able to be outdoors and go walking on the trails, but wearing the correct socks and light colored clothing and tucking your, just being cautious and smart about this, I think is the best way to go. And that's all that I have for now. But again, happy to answer questions at the end.
Thank you, Dr. Moran. Up next, First Warden Keith Stover.
Thank you, Nettie Rose. Good to see everybody. Before I started, I just want to take a second and thank Byra for putting this together. I was just looking at the attendees, so 99% of the attendees know that Byra has been at the forefront of this ongoing struggle that we have on the island around these tick-borne illnesses. And as it has for all of us, it has really ramped up with the growth in alpha-gal. So they have been generous supporters of deer tags, deer tails, etc. Just have been great partners to the community and partners to town government. I thought I'd start by saying something you probably don't hear very often from someone who holds elective office. I was wrong. When I started on the council, I was of a mind that we could figure out kind of a middle path on some of this, because everything was hunting, not hunting, hunting this day, hunting not that day. what are the sort of things that you can do? What are the tools you can use to make this thing more in balance? I've concluded I was wrong about that. And I think, it's fair to say that the council, which has been unanimous in its concern about this, also thinks that it is well past time for something significantly more progressive, more aggressive when it comes to these tick-borne illnesses, which was really glad that Byra's flyer said really is a public health crisis. And that's really one of the things that I really want to ask a few things tonight. I'm obviously not a scientist, not a doctor, but the first thing I would ask is that we start a process of expunging the word hunting from our vocabulary, because this is not an issue around recreational hunting. We have a tremendously high load of deer per acre. As Dr. Telford said, we are so far from 10 or even 40 deer per. I can't remember what the last number was, but it's pretty mind-boggling. And our hunters have done an extraordinary job aggressively culling the herd, and yet we're still not there. So I came to understand that using the word hunting around this was the something I had to change when I was at a hearing before the legislature this spring, and one of the advocates for the recreational hunters in Rhode Island approached myself and another member of the council, Bill McComb, to talk about this issue. And he said, I think you're kind of barking up the wrong tree here. You're trying to fit what is a public health problem into a recreational hunting statute. And in fact, what you need to do is really look at this more like the way, say, farmers are enabled to look at deer populations that are predating their crops. It's a different mindset, and it is specifically non-recreational. I also happen to think that, Dr. Moran was talking, used the word that alpha-gal is underreported. I mean, I think all of us, most of the attendees, probably all of the panelists, have the same experience I do, which is that at least once a week, I hear about a different person who's been diagnosed with alpha-gal. Now that's anecdotal, but a lot of the cases, one just this weekend was diagnosed by the person's physician in Fairfield County. And we don't get that data. Rhode Island doesn't get the data. Nettie Rose has been really terrific about partnering with Amy Land on collecting this data. And Nettie Rose, I don't know whether you're going to address this, but it strikes me that it could be time to sort of reinvigorate that data collection that you were doing, and that the town was doing this spring. Because I really worry that there are cases that we just don't capture in our data, and I think the numbers are even more compelling. Not that if we have 100 cases, that's serious, but I think they're probably even more compelling. One of the things that I've noticed over the last few months, and I'll be very interested in hearing what Senator DiMario says about this, but with a lot of the writing that has been done, a lot of the things, you almost can't turn around without seeing an article about alpha-gal. I think you are able to witness over the course of one legislative session the dawning realization among mainland policymakers that we have a public health issue here. And I think that's important and is paving the way toward some innovative approach here. And that's really borne out by the resolution that Senator DiMario and Representative Spears were able to pass this spring, where for the first time we have the town of New Shoreham, the Department of Health, and the Department of Environmental Management working on this together. It's the first time the Public Health Agency has been really engaged in this kind of what do we do about some of the root causes on these tick-borne illnesses? And I'm very encouraged by that. And if I haven't said it in this call, Amy Land is doing an incredible job of building those relationships and working with those agencies. So the level of awareness, if you will, I think has increased dramatically. And then finally, a couple things. One is, as I think Dr. Telford alluded to this, but I heard anecdotally that the research that the town is helping to fund along with DEM has begun, and the researchers who have been out here have been quite literally blown away by the number of ticks we have. We all know that, but not everybody knows that. There are three things that we need here. One is any solution that we come up with is going to require a significant amount of patience. This is not going to happen. We're not going to fix this problem in 6 months or a year. It's going to require patience and a consistency of effort. It's also going to require some community mindedness, because if, for example, one of the solutions is organized hunts, that is going to mean that the walk that I usually take with my dog on Saturday morning on the breed property is going to have to happen on another day, because that happens to be a place where there's an organized hunt. And I understand it's a pain in the neck, but boy, our conservation organizations and the town have miles and miles of trails, and we're all going to have to be aware of these activities going on to the extent that we ended up agreeing to them. And finally, it's going to require a lot of discipline. One of the things we struggle with in our culture, I think, is maintaining a thought in our heads for longer than a week. Well, this is going to require some ongoing discipline to manage this, and I do think the fact that we're an island helps us, because the deer aren't going to get pushed to other towns. They're here before us, but it is going to require a constancy of effort and some discipline. So thank you all for having me. I'll shut up.
Keith, I didn't have to give you a 5-minute reminder.
That's the first time that's ever happened in my lifetime.
Thank you very much, Keith. Senator DiMario?
Thank you, everybody. And I just want to echo Keith's gratitude for the Block Island Residents Association for putting on this forum and for inviting me to participate. My name is Alana DiMario. I've had the pleasure of representing Block Island in the Rhode Island State Senate since 2022. And I will just kind of dovetail on some of the things that Keith had talked about the way that your town government and state government have been working together on this issue, really starting before this past legislative session, which began in January. This kind of alarm with increasing frequency was raised both to myself and Representative Tina Spears from both your town leadership as well as island residents when we would come out to meet with people, just, kind of around this increasing awareness that this was increasingly a public health issue. And so as the legislative session began in January, we met with the town council and your town manager, Amy Land, to try to talk about an approach to this. And, our legislature meets part-time January to June. And so when that session starts in January, the clock starts ticking of, the things that we can introduce and then get passed before we adjourn in June. And so we started that conversation around the idea of, how do we find what the right approach and the right interventions are going to be? And right away in January, the town council really landed on the idea that this needs to be looked at not just as a DEM deer mitigation issue, but also within the context of a public health issue. And so as we moved forward through the legislative session and that original proposal was introduced, as Keith mentioned, the hearing that they had on that in the House side was very useful because, one, it did raise the profile of this issue that's happening on Block Island with people upstate. So the General Assembly, was able to get some more information about what was going on there to start thinking about what a solution could be. And then also it did draw out some, I think, very useful testimony from people like the man that Keith mentioned, who actually is a constituent of mine here on the mainland. He lives in North Kingstown, who had a lot of really great ideas and input about maybe how to approach this. So just to give kind of a timeline or a progression of what the original legislative proposal was, it essentially was looking at doing a carve out for hunting regulations for Block Island to allow for some flexibility about deer population mitigation. And the concerns that were raised around that, opening up that particular statute, was the idea of setting a precedent for other towns to then be able to do kind of what they wanted to do with hunting, which may or may not be actually associated with any type of public health issue, public safety issue, et cetera. And so being able to pull back and look at, what some other possibilities would be, I think was a very helpful process. Now, again, we came up against the end of the legislative session, but Representative Spears and I did not want to adjourn without having something formalized around making sure that in our roles as your state representation, we could bring together the appropriate stakeholders to move forward on a strategy and move forward on some interventions before the next legislative session started in January. And so that's where, in cooperation with town leadership, we developed this idea of a resolution, which is not a new law, it's not a new statute, but it is something that is binding, that basically formalizes the idea that the Department of Environmental Management, the Department of Health, and your town leadership need to get together to be able to do a couple of things. And so I'll just share a couple of those highlights. One is that it formalizes, what those strategies, that there should be some strategies proposed. And so it kind of puts some parameters around that. It talks about this in the context of creating a comprehensive public safety plan around tick management and also around, making sure that the public is informed about any of these interventions, like Keith was just mentioning, if there are going to be targeted hunts and things like that. There is that there will be mechanisms that the town can apply to DEM for some targeted deer mitigation, that there is a reporting requirement for the Rhode Island Department of Health, the Rhode Island Department of Environmental Management, and also that those reports will come to the General Assembly so that we can stay up to date on exactly how these interventions are progressing. One thing that I think is very important is there also is a provision in there that requires data collection, because one thing that we always want to make sure of, whether it's a statute that we're passing or, some type of temporary measures that we're putting in place, we want to make sure that those interventions are actually having their intended purpose. And so if the intended purpose is to reduce the incidence of tick-borne illnesses, for example, we want to make sure that we have that data and that we can match that against the different things that are being put in place to see if it's actually working. And then the final piece to that was also talking about public education. And so again, that's one of the things that we're here doing tonight. And I don't know that that necessarily needed to be something that was that we had to compel the town to do, because again, I know your town leadership has been very invested in this, as has the Block Island Residents Association, but also to the extent that it is helpful or necessary, we want to make sure that the Department of Environmental Management and the Department of Health participate in being able to do that public education. So that's where things stand right now in terms of the resolution that was passed. We are anticipating we may need to come back with some different legislative proposals on this, depending on what the conversations are around how to move forward that happen in the meantime. And so I will also just say that as a general note or general approach, both Representative Tina Spears and myself we look at our roles in the state as taking direction from the municipalities that we represent. So, I'm not going to, be kind of come down from the state and tell you guys this is what you should do to solve your problem. I'm here to kind of listen and take on what it is you guys say you want to do and then advocate for that at the state level. So again, whether that is some type of regulation change within a department, whether that is bringing, the right people around the table to pay attention, whether that is potentially getting the consensus in the House and the Senate to do some statutory changes, those are things that are going to come from Block Island. And so I, anticipate being in consistent communication with your town leadership to be able to hear about what it is that you guys want to pursue and how I can support those things. And that is what my continued role in this is going to be. I will also just say in closing, as a note, I'm very appreciative of being able to also listen to the expert information that was presented tonight, both by Dr. Telford and Dr. Moran, because in addition to being your state senator, I also am a frequent visitor to Block Island in my recreational time. And so I have taken notes about all of the things that I need to do to protect my family and I when we're out there in a couple of weeks. And we certainly will be doing that. And also those are some things that I can, share with my constituents as well, who like to come over from the mainland side and visit the island as well. So thank you for sharing your expertise. And I am looking forward to being able to answer any questions from my perspective that the guests might have on the webinar. So thank you very much.
Thank you, Senator DiMario. At this time, I'm going to turn it over to Joe Loya, who will be moderating the questions.
Okay. Thank you, Nettie Rose, and thank you all for some insightful comments throughout. I'm just going to remind our audience to submit questions on the Q&A. We have received a number of questions for all of our panelists, so I'm going to try to sort of sample them. I don't know that we're going to get to all of them, but actually I want to start with a question for Sam, and it has to do with mice. The question from the audience was, if mice are the ones that infect ticks with Lyme disease, why are we more concerned about removing deer? Shouldn't we be trying to eradicate mice?
The mice are a source of infection for the ticks. That is certainly true, and the ticks are born uninfected. However, as I tried to point out, if you attack and kill 1,000 nymphs or larvae, it's compensated for by a single adult female tick feeding successfully on a deer. And it's the old chicken or the egg argument. You won't have infection among the mice if you have fewer ticks. And you can only get fewer ticks by attacking reproduction. And all of the reproduction happens to be due to deer. And so that's why the biggest bang for your buck is to try to intervene at reproduction as opposed to infection. Now, with infection, it's not just mice. It is passerine birds, it's shrews. So there are many animals that can contribute infection, and we can't really target all of them. We can't go out and say, we want to kill all the mice, or we want to treat all the mice, or we want to kill all the birds, because that just is not ecologically friendly.
Can I ask a follow-up to that, Joe?
Yep, go ahead, Keith.
Hey, Sam, everything I've read, unburdened as I am by anything resembling a scientific degree, everything I've read says that is even more the case with the Lone Star tick, that the deer is the critical vector.
You're absolutely right. The three stages of the Lone Star tick, the larvae, nymph, and adult, are feeding on deer on Block Island. Elsewhere, things like raccoons and skunks are feeding larvae and nymphs. Rabbits, which you don't have on Block Island, feed some Lone Star ticks. Squirrels as well. Quail, turkeys, they all feed larval and nymphal Lone Star ticks. But in general, the only thing that's producing ticks, the reproduction, is deer and Lone Star ticks. And the Lone Star ticks, a fed female will lay 3,000 to 3,500 eggs, as opposed to 2,000 for the deer tick. And so they're way more prolific. And the more deer you have, the more Lone Star ticks you will have.
Gotcha. Okay, thank you. So Sam, just a follow-up, and this has to do with permethrin. There was a question about what's the difference between permethrin and DEET, and do they both work, and how are they different, or are they used differently?
They should be used in a complementary fashion. DEET is a repellent in a completely different chemical class discovered in the 1950s, and literally billions of doses have been applied as a repellent over the past 60 years. It's very effective. It confuses things like mosquitoes and ticks so that they can't really find your skin. Permethrin is a toxicant. It actually poisons arthropods. It poisons mosquitoes. It poisons ticks by contact. And it's a synthetic analog of the pyrethrins, which you get from chrysanthemum flowers. So you can actually use chrysanthemum extracts as a toxicant. It just takes way more of it, and it doesn't last as long. But permethrin is not regulated, is not allowed to be used on skin. It doesn't mean it's not safe. It just means that EPA and FDA have not allowed, have not received documentation nor an application to use it on skin. So you must use it on clothing. And if a tick crawls across that or a mosquito lands on it, within an hour or two, that tick or mosquito will be dead. DEET prevents them from even getting on you because it confuses them. They can't find you. So I recommend strongly that people use the permethrin treated clothing, but also use repellent. And, you know, in the case where you're just running out to your compost pile and you don't want to put your permethrin treated clothing on just to go to the compost pile, spritz yourself with some DEET. It works very well. In fact, CDC has a list of DEET equivalents, including picaridin and IR. You know, there's another one that they recommend as well that they've determined work very well. There are a lot of so-called organic things. They don't work, whatever. But those two, DEET and permethrin, are the cornerstone of your personal protection.
Just one more clarifying question that came up regarding permethrin. There was a concern about the cats. And it apparently permethrin can be dangerous for cats, so that immediately caused some concern, and we had a couple of questions about that. Can you address that in this context?
Cats don't have the liver enzymes to detoxify permethrin, but it applies only if they're exposed orally to it when it's still in the wet form. So if you have permethrin treated clothing that has been dried and the cat isn't sitting there licking every last square inch of it, then it'll be fine. It's you don't want to spray the permethrin when the cat's near, because that's a wet form that they presumably can groom off themselves and ingest.
Thank you. I got a follow-up question for Keith, and this has to do with information campaigns. We talked about public education being an important component here. Is there? Can you speak to any initiatives so far that are underway, or with regard to public education and informing visitors?
I think it's starting, and it's been more, frankly, organic than I would like. You know, you've seen some of the signs at some of the trailheads, those sorts of things. It would be my hope that we would convene sort of BIRA, conservation groups, health services, town, you know what I mean? And I mean, I don't think it's a question of resources. It's a question of developing the campaign, so that there's better awareness. I was noticing in the Q&A, you know, there's, when you've been wrapped up in reading, by the way, if you haven't read the New Yorker article about alpha-gal, read it. It's worth reading, everybody. If you want our login number, I'd be happy to share it with you. It's excellent. But when you're sort of wrapped up in reading about this stuff, you forget how relatively new it is, in quotes. And I was noticing in the Q&A, there are, you know, at least a few questions about, like, could you give us a more detailed rundown of how the symptoms of alpha-gal work and when they appear, and, you know, those kinds of things. I think we are, you know, as a town, I mean, I'll take responsibility for this, sort of undereducating on a lot of the basic stuff about some of these diseases. I think we operate under an assumption because Lyme has been around so long that everybody knows what Lyme is, but I don't think you can. I don't think you can necessarily just assume that. So it's a really good question, and we're going to start working on it.
Thank you. This is a question that I think is partially Keith and certainly Alana. There were two bills that were submitted this spring, one to the House and one to the Senate. The House bill didn't get very far. But the House bill was really focused on giving the town more authority, specifically in the whole area of deer reduction. I won't use the word management. I think you might have addressed some of this, Alana, in your comments. But I guess the question following is: are we correct in assuming that you're going to need more guidance from Block Island, from the community and the town leadership in order to maybe get the Senate to introduce a similar bill? So again, the focus here is, where do we go in terms of more aggressive deer reduction tax and ultimately giving the town more autonomy in that regard?
Sure. Yeah. So, absolutely, new legislative session, the door is wide open for whatever proposals we want to put in, including multiple proposals. So there was a bill also that I introduced that ultimately we didn't move forward with a hearing on because we went in a different direction. That was a kind of more comprehensive look at allowing a municipality, and giving some structure and support to creating a tick mitigation plan and a tick management plan. Then it didn't have language specifically focused to Block Island. It was something that would be open to a number of municipalities. And so one thing that I neglected to mention in my initial presentation, but is I think appropriate to mention here, is that since this conversation has progressed and since the legislative session has ended, I have now actually heard from people on Prudence Island as well as people on Aquidneck Island who are very interested in watching what Block Island does to mitigate this issue because they are facing similar concerns. And so, I think that when we start the new legislative session, we may be looking for some Block Island specific exemptions or regulation changes or things like that. And also, I think we will be looking at how these lessons learned and the conversations that Block Island is having with the Department of Health and the Department of Environmental Management might lead to a model for some of our other island communities. Because even though we don't think of Aquidneck Island as a true island, those deer aren't really crossing the bridge. So, they're pretty contained on there as well. And Prudence Island is also self-contained. I think that this will serve as a potential model for something that we could create that would be more applicable to other municipalities as well. So it would meet Block Island's needs, but also could be adapted to others instead of having to kind of do town by town piecemeal type things. Because again, as I mentioned, we're only in session January to June. And so when we're looking at solving problems like this, we also want to create something that allows for the municipalities and then departments like DEM and DOH to have that regulatory authority to make decisions and take action even when we're not in session, because we don't want to have to wait again until the next January to come back at it. So that would be my thought, is that we'd be looking to introduce matching pieces of legislation in the House and Senate that both meet what we have identified as Block Island's needs for statutory and regulatory changes, but also has broad enough language that other towns can access that as well, and we don't have to go one by one.
Okay, thank you. We're getting quite a number of questions around deer eradication.
Yeah.
And the unspoken issue here on the table is that DEM is generally focused on preserving deer and making hunting available for recreational purposes. But as Sam pointed out, getting the deer population down to something like 5 per mile, would mean getting, less than 100 deer on Block Island. So that requires aggressive deer reduction, not deer management. What is getting in the way of the DEM is getting in the way right now, perhaps, but that's my opinion. But what is the barrier to that kind of action that ultimately is needed to, in fact, reduce the incidence of tick-borne diseases?
Sure.
Well,
So
probably,
and that's
I'll let you. Keith, did you want to field that one first?
Yeah, I'll start.
Yeah, that's fine. You go ahead.
I was probably being too obtuse when I said this, but this is what I meant when I said we have to stop talking about, we have to expunge hunting from our vocabulary, because it's not a hunting issue. It's why it's important that the Department of Health is at the table, because I happen to agree that we have to engage not just in hunting, but we have to attack this issue the way that we attack significant diseases, and have attacked significant diseases over our history. I don't mean Block Island's history. So yes, I did not initially, as I said earlier, think that we needed to do eradication, or whatever the word is. I don't think eradication is probably realistic, but we have got to be significantly more aggressive. Doesn't even quite capture it, in my opinion. But this is also what I was getting at when I said, we as a council and as a town government, again, went at this as, what do the hunting laws say, and how can we figure out a space for us to change that hunting statute? I'm now envisioning something that is perhaps significantly less complex than that, which is essentially declaring that we have a public health crisis in one of our towns. It is an isolated town with an isolated deer herd population. You're going to have tools in order to reduce this risk. And these are the consensus tools that health officials, environmental officials, town officials, and the community have developed as consensus tools. So I get why DEM was very concerned about our initial draft, which, by the way, what was heard was essentially Block Island owns the deer and Block Island can control its own hunting rules. And I get it. They don't want to set that precedent, but I do think there is awareness that we need to address a public health issue on Block Island.
Thank you, Keith. Alana, do you want to add anything to that, or is that?
Sure. No, I mean, I will just add that the conversations that I've had from the state perspective have included putting that on the table. So I've asked that question of, if we're looking at cost versus benefits, pros versus cons, what role do deer have in the ecology of Block Island? And the answers that I've gotten so far indicate to me that complete eradication of deer on Block Island is a conversation we can have. That is something that we can put on the table to have as a goal to work toward, if that's what the town asks us to do. So again, I'm not in, DEM isn't going to come in from the state and say, we're taking all your deer. But if that is something that is decided within the context of these conversations is a feasible strategy, or a desirable strategy, then that is something that I'm absolutely willing to pursue. And my understanding is that there is nothing that prevents that from being a goal, in terms of, deer don't serve any purpose on Block Island, ecologically, to my understanding, that would warrant them needing to, a certain size of population needing to be preserved out there. So if that is the conversation that Block Island wants to have with the state, then that is something that I'm fully willing to advocate for.
If I might comment, the Block Island has voted twice at their town meetings to eradicate deer. One was back in the mid 1990s when I was working out there, and they resolved to do so to remove every last deer. And then the Lyme disease vaccine trial that I was running came along, and people lost their support for culling deer. The second one was much more recent, 10 years ago or whatever it was. The town appropriated $1 million and hired White Buffalo, the experts in deer removal, to come in. That it was such a done deal that the week before it was supposed to happen, I mailed my friends at White Buffalo a package of blood tubes because I wanted blood samples. And then all of a sudden it was off because an activist found out that White Buffalo needed to use a suppressor on their rifles in order to take several deer at once. And using a suppressor in Rhode Island is prohibited. That is statute that needs to be removed in order for there to be effective deer culling. And so that is the hindrance, that is the obstacle that you have for deer elimination on Block Island is that suppressor law. You cannot use a suppressor in Rhode Island. So if you can't change that, you're not going to remove your deer. White Buffalo actually withdrew. They left $1 million on the table because they couldn't do the job. So if that's in the discussion, you need to start talking to law enforcement and anybody else about removing that statute. But in Massachusetts, we have the same issue with the conflict that the Department of Fish and Wildlife has, the commitment they have to steward their natural resources. They are vehemently opposed to culling because it removes natural resources. It's a waste of natural resources. And what they've been trying to do recently at the stimulation, at they've got a relatively new young deer biologist who's willing to consider all sorts of new things, including liberalizing the issuing of agricultural damage permits so that people can take deer whenever they want. And it's a very broad definition of damage. And so instead of having to do everything in the fall, you can actually target deer at their lowest level in the early spring and prevent them from actually feeding Lone Star tick adults and allowing them to reproduce in April, May, and June. So there's that kind of thing that they're trying to do. They're trying to remove the 500-foot setback for hunting from inhabited homes and bring it down to 250. New York has a 150-foot setback, and that helps access for hunters to be able to take deer near to homes. So that's something else they're trying to do. They've got a great venison donation program, and as I understand it, you guys have done that as well. Or if you haven't, you should be doing it, because a responsible hunter is not going to take more animals than they can use. And so all of these things can be used while you're trying to come up with a way to actually remove deer entirely. But I think removing that statute about suppressors is going to be very, very difficult. But that doesn't mean you admit defeat. You use modifications to existing hunting regulations and try to take as many deer as you can that way. And in fact, our deer biologist here is like, I'm giving you these tools, show me that you need more than that, and then we'll talk about culling.
Thank you, Sam. I have a couple of questions that I want to direct to Liz. Sam actually mentioned or showed some pictures of rashes. And so a couple of questions were, well, what does a rash look like from a Lone Star tick? Another question was, I was bitten by a Lone Star tick. What should I do? Is there a treatment or a vaccine that is available for alpha-gal? So maybe you can address a couple of those, Liz.
So let me try and answer the faster one. So there's no vaccine available at this time for alpha-gal. So that's not something that we have available to us at this time. I think the picture that Dr. Telford showed was of just like tick bites, and you can correct me, Dr. Telford, if that's not the case. It wasn't so much a rash, it was just like local irritation from local bites. So anytime we get like bug bites from, you can have some local irritation. So there's not a specific like Lone Star rash. It's just that if you get bitten by a tick, and I think what he was trying to show is like how many of those little bites were on that one side that was not covered by the permethrin treated socks. I think the other question was what I got bitten by a Lone Star tick. What should I do? Um,
Yes.
so, so it's important to remember that not all Lone Star ticks can induce the antibodies for alpha gal, right? So not all ticks can induce the antibodies. Not all people that have antibodies develop alpha gal syndrome. And in fact, when they do population studies, there's some population studies that suggest something somewhere around 25 to 30% of the population will test positive for the antibodies. And we know clearly that not 25 or 30% of the population has alpha gal syndrome. So the rest of that is a little bit less satisfying, like what to do if you get bitten by a Lone Star tick. What you need to do is just be aware of your body and of symptoms. The thought is it can take several months to develop alpha gal syndrome if someone is going to develop the syndrome. So again, most people will not. And then I think Keith was mentioning like there needs to be more talk about what exactly is alpha gal syndrome. And I'm sure there's people on this call that have alpha gal syndrome who could speak to it, better than I could. But what we use to say this meets or this sounds suspicious for the syndrome is someone who has a mammalian meat allergy. So not chicken, not fish, but mammalian meat or dairy products. Somewhere in the 2 to 6 hours after a load of that in their diet, so like a big heavy meal, develop either a hive-like reaction, itching, kind of body itching, or GI symptoms. So just real severe GI symptoms, stomach pains, diarrhea, and those can be kind of non-specific. So it can be hard to kind of piece this together. And again, this may be, again, part of why some of this is underdiagnosed or why alpha-gal syndrome isn't, recognized. And then later on, people put it together like, okay, this was what was going on. So, but again, not everyone who's going to have a tick bite, not all of those ticks can cause you to develop the antibodies. Not everyone with the antibodies develops the syndrome. You just want to be aware. And if you start to have symptoms that sound suspicious or consistent with that, 2 to 6 hours after a mammalian meat meal, developing symptoms, hives, severe stomach pains, that you come in and talk to a provider about whether or not you should be tested for that. There was one other thing I was going to say related to that, which of course is my mind. Oh, and then just like being involved in panels like this and being involved, being advocating for more public health work to be done, could be helpful for people to share their stories or to kind of add to the data. And also working on reducing your risk of recurrent tick bites. So maybe you had one Lone Star tick and we don't know if that tick would even lead down the road to alpha gal, but you want to decrease your risk for ticks in the future so that future tick bites don't lead to that. I don't know if Dr. Telford, if you have anything else to add to that or.
Yeah, no, I wholeheartedly agree with your last point that the very fact that you have had a Lone Star tick bite means you need to up your game, right? You need to use the repellent, you need to use the permethrin treated socks. But to go back to the rash thing, in the absence of alpha gal, let's pretend alpha gal didn't even exist. Lone Star tick bites are miserable. They hurt, they itch, the itch persists for weeks to months. And they are the devil's spawn, really, in the absence of alpha gal. And so some people, and within the next 2 or 3 weeks, you're going to start seeing this if there are lots of so-called tick bombs, these clusters of thousands of Lone Star tick larvae on a single grass blade. You brush by, you get hundreds of them on your leg. If you're wearing shorts, you're going to get bitten. It's going to itch like crazy. And that's when you go see Dr. Moran.
This is to both doctors here, Sam and Liz. Are you aware of any vaccine activity for either Lyme or alpha-gal? Is there anything in the works that you're aware of?
The Pfizer Lyme disease vaccine trial ended last year. The results were not spectacular, but consistent with the previous Lyme disease vaccine, about 70% efficacy. The statistics weren't impressive, but that's because we've had 2 low transmission years and they didn't get enough positive cases. But nonetheless, I believe they are going to the FDA. They're probably at the FDA as we speak. And it is my guess, I have consulted for Pfizer, that they will be selling the vaccine next year. For Lyme disease. It's only for Lyme disease. And so a lot of people are like, well, why should I just get Lyme vaccine when there are all these other tick-borne diseases around and I still have to protect myself? And the point is, well, there's no vaccine for HIV, but you don't neglect getting your hepatitis B vaccine because there's no vaccine for HIV. Get the Lyme disease vaccine. It's still the most common tick-borne infection. There is no vaccine. There will not be a vaccine for alpha-gal disease. We don't even know what it is the tick is doing to cause an allergy in people who are susceptible to allergies. And again, that's an important point. Not everyone gets allergies. There is no one-to-one correlation between being bitten by a Lone Star tick and definitely getting the allergy. I've been bitten dozens and dozens, if not hundreds of times by Lone Star ticks, and I don't have alpha-gal disease. There is some hope on the horizon for those who have alpha-gal disease. There's a drug called Xolair, Xolair, which is now being used on a off-label. Well, it's not off-label. It's used for asthma to try to alleviate the severity of the reaction to red meat, which will allow some people to start eating red meat again. So it's a very expensive drug, but it all depends on whether your insurance picks it up. But that, there are more and more treatment trials being done now for alpha-gal. So I think, within the next 2 to 3 years, there may be more options for that.
So a question came up. Oh, go ahead. Sorry.
The severity of disease can vary greatly by people. Some people have very, very severe disease, and other people can, manage a little bit of mammalian meat or a little bit of dairy products without any problem at all. Or, maybe they just have a little bit of a rash. So it can vary quite a bit. There's some thought if people have a break from mammalian meat that maybe they could reintroduce later on and not have the severe disease. So it's quite variable.
Okay, thank you. A question came up with regard to what property owners might be able to do to reduce the number of ticks on their property. Mention was of some kind of insecticide or traps or anything like that. Are there things that a property owner could do to help this particular case?
I highly recommend the use of granular insecticides, especially around yards. They're sold in Home Depot for your tomatoes, for God's sake. A lot of people are very leery about insecticides. A lot of people read Rachel Carson's Silent Spring, but you got to remember that was 1961. Our parents were driving Studebakers. What are we driving? They were driving Priuses and Teslas. Insecticide technology has changed as well. And so today's insecticides are toxic to insects and ticks at levels that are minuscule. Very little is put into the environment. They break down faster. And if you use granules as opposed to spraying, you won't affect the pollinators, which is one big concern that people have in insecticide use. You apply it with a broadcast spreader, and you want to use a pyrethroid. There's a popular product, Bug B Gone Max, which I recommend, but its active ingredient is bifenthrin, which is a pyrethroid. In Europe, they consider it a PFAS compound. Here in the US, EPA does not, but nonetheless, there's a lot of concern about PFAS. So there's lambda cyhalothrin-based triazicide, I believe it is, that you can buy in Home Depot, which would do just as well. You apply it as directed on the label of the bag, and you do it. You can do it in March. You can do it in June, and you can do it in late September, late July, maybe early September. And you're targeting all three stages. This stuff gets down into the leaf litter or into the ground where the ticks are hiding and kills them. And I know people without a spleen living on Cape Cod who are doing this in their yards. And normally I would tell them, leave because you'll get babesiosis and you'll die. But they've been able to avoid tick bites because they put this granule stuff around their yards and kill the ticks. The stuff binds to soil, so it does not get into the water table at all. And it disappears after, 3 or 4 weeks. So that's something people can do. Is to use these granular pesticides that you can buy in Home Depot for your vegetable gardens. And they work very, very well. Yes, they kill all sorts of insects. They're not specific. You cannot apply them within 150 feet of water. But other than that, there are many properties that are not within 150 feet of water.
Can I just
Thank
add
you,
to
Sam.
that? Also just thinking about, like keeping the pathways cleared and not having lots of high brush along, like making sure you have nice wide pathways from where you walk to into your house. Obviously people want to be out on trails, but staying away from that high brush where the ticks tend to hide out.
Okay. I think we're close to wrapping up. Actually, I've got one more that's for you, Sam, and it has to do with birth control or contraception as a viable technique for reducing deer population. Could you speak to the effectiveness of deer contraception?
They're getting better. 5-10 years ago, the products were very crude. They were actually made in pigs. They're pig products. And you needed to deliver it 3 times within the year by dart. And deer get smart, and it gets harder and harder to re-dart them. So they're trying better ways of delivery with better contraceptive vaccines. But the point is, it's way easier and more and less expensive to do this with fewer deer. So you start by reducing your deer herd, and then you maintain them at a lower level using other things. You continued hunting, but also with contraception. But the contraception technology isn't quite there yet, but it will be.
Okay, thank you. Does anyone have any other comments that you'd like to make? So I think we're close to wrapping up at this point. We'll have a few closing comments.
I'll jump in if you don't mind.
Sure.
Great.
Go ahead, Alana.
I just wanted to thank Dr. Telford for highlighting the just going back to the deer eradication question, the history of kind of how those conversations have gone, and specifically for highlighting one of the things that we might need to look at in terms of a statutory change. And I do just want to say that in many different instances we design statutory changes that also have sunset provisions. So it might be a hard hill to climb to be able to completely overturn or revoke that suppressor ban statute. However, it is, I think, very likely, or much more possible to be able to design something that would allow for, a targeted use in a specific municipality or for a specific period of time. And we build that into, statute changes that we do all the time. I mean, actually, one of the most common examples is we actually pass laws to allow people to perform wedding ceremonies, but we do it, one person to join these 2 people in marriage for this, specific point in time, a 2-week span or something like that. And we actually pass a law that says that people have a limited ability to do that. So, I just wanted to leave this conversation with the idea that, something like that is very possible for us to have a conversation around. So for people who are interested in having a further conversation about pursuing the kind of eradication plan, I think that there are ways to work around those hurdles. And I'm very interested in working with your town leadership to figure those out. So thank you for highlighting that history.
Okay. Keith, I do have
Yes.
another question here, which is will the town commit to a vote on eradicating all deer in the island? That would seem to be a controversial point. Would you consider a vote at some point?
I mean, if we need one, absolutely. But I don't think there's. I think there's remarkable community consensus about this right now.
Okay. And we have one more that came up for Liz. An attendee said that Xolair was approved by FDA for food allergy indications in 2024. It's being used for treatment of food allergy indications. Is that an option for food allergies for alpha-gal?
Yeah, I mean, I think, somebody with alpha-gal, we would recommend that they have an allergist and that they would work with their allergist around figuring out what the best treatment options are for them. Yeah. But yes, it's definitely on the table as an option.
Okay. All right. Well, listen, we've reached our closing time. So first of all, I want to thank all of you for joining us. I think this has been informative and we've raised a lot of great issues. And I want to thank all of our audience. We had great participation this evening and I hope it's proven productive and helpful. I personally want to thank the Block Island Health Center, Nettie Rose and Liz, for their cooperation and collaboration with BIRA on pulling this off. We've been working together for the past several months. As you know, BIRA also has been sponsoring a treated sock promotion campaign, and we've worked. First of all, that idea came to us last fall from Sam, and we picked up on it, ran with it, and we've been working closely with Nettie Rose in particular, and sort of getting some educational content out there. It's been we've had quite a lot. It's been very popular, so we're happy to have done that.
Because I was out in Rodman's Hollow collecting ticks, and a mother and her two children were out there. She was spraying one with DEET, but they also had permethrin-treated socks, and I complimented them on their socks, and they go, "Oh yeah, we just bought these at the farmer's market this morning." And I understand that it's BIRA that is sponsoring that.
Yeah, so for those of you out there, they're available at quite a number of retailers on the island. So I would encourage you to, if you don't have a pair, get your own treated socks. We'll be selling them throughout the summer. So with that, I think we're ready to wrap up. We did record this session. We will make it available. We'll distribute a link online in various ways. It'll be on the BIRA YouTube channel as well. Thank you so much. We have a lot more work to do. Looking forward to continued collaboration with the health center and with the town as we really try to make some marked progress in this area. So thank you all, and
thank you,
enjoy
guys.
the rest of your evening.
Take care.
Thank
Bye-bye.
Take care now. Bye-bye.